this thing. Can you push it up a bit?
Okay.
Yeah, okay. Great. Thanks. All right, we're going to start now. Hello and welcome to Health Live at Seniors Today. We were interacting with the doctor from Bengaluru last week, and we said let's stick around in Bengaluru and have our session for today as well. The topic that we are dealing with, in fact, two topics that we are dealing with. One is dealing with hormonal changes due to aging, and of course diabetes, because we have here with us Dr. Anirudh Shetty. Before I request him to speak, I'm going to introduce him. Dr. Shetty is an expert and experienced endocrinologist with the experience of over 15 years, which is that he specializes in diabetes medicine and management. He has done his MD in internal medicine and a DNP in endocrinology, and he works with the Narayana Health group of hospitals in Bengaluru. Welcome to Health Live at Seniors Today, Dr. Shetty.
Thank you.
Dr. Shetty is going to be talking about these two topics that I mentioned, and it's over to you, Doctor. Before I request him to speak, those of you who have questions, please put them in the chat. We now do not have a Q&A tab, but you have a chat window. Please put the questions over there, and I will address them later on. As always, mention your age and your gender. Also, remember these questions, the answers to which you'll be given are advisory in nature. And do remember that, if you need any specific advice, specific medical advice, you need to meet a doctor. Of course, you can also interact with Dr. Shetty online if you are not in Bengaluru, and consult him. Over to you, Dr. Shetty, and then we will, and once again, as you also know, that this presentation, if you're not able to take notes or whatever, remember it is the recording, the edited recording will be up on the Seniors Today website on Monday evening, along with the takeaways, which, as you know, is written by a medical practitioner. So these will be there. So don't worry, just keep watching and ask your questions immediately after this. Those of you who are watching us on YouTube, do remember that if you are on Zoom, you could be asking questions to the doctor live, but otherwise, suit yourself and keep watching. Thank you, doctor. Over to you.
Yeah, thank you. So, good evening, everyone. I'll be covering two topics. One is about diabetes, that is fighting diabetes, and the second thing is about hormonal changes and aging. So, this will be the agenda with respect to diabetes, the overview, the types of diabetes, the risk factors, symptoms, the complications, and management. So, coming to the prevalence of diabetes. So, we know diabetes is a big problem in India. As you can see, around 7.7 crore people are there with diabetes. And it is also called as, India is also called as the diabetes capital of the world. So coming to the overview of diabetes. So basically what happens is the food is, in a simple language, food is broken down into sugar, and the sugar enters the blood, and insulin allows the sugar to enter the cell and provide energy. And the amount of sugar in the blood reduces. So basically, insulin is like a key which opens the lock, and the blood glucose, which reduces via it goes into the cells. So as you can see on the cartoon on the left hand side, so you require the insulin for the glucose to enter into the cell, and then energy is produced. So this is how insulin helps the body use glucose from the bloodstream for energy. So as you can see, uh, whatever you eat, it is basically broken down into glucose, and the pancreas secretes insulin, and insulin attaches itself via a receptor to its cells, and the uh, glucose door, you can think that the glucose door becomes open, and insulin opens the door so that the glucose can enter the cell and it can be used as energy. And this is how the body metabolizes glucose in a normal person. So, as I told, this in a healthy individual, so you can see the glucose enters into the bloodstream, then insulin is released along with it, and the glucose is either stored in the liver, or it is used up in the organs like muscles or adipose tissue. So, without insulin, the glucose cannot enter into the cells, and hence the sugar levels increases in the blood, and cells do not get energy. And this can happen when the insulin is not secreted from the pancreas in enough quantity, or the cells are resistant to the action of insulin. So coming to the types of diabetes, so there are basically three types. Type 1 diabetes, when there is absolutely no production of insulin from the pancreas, and this is generally seen in children. So peak incidence is around 9 to 14 years. And the second most common type what we see is type 2 diabetes, where the pancreas doesn't produce enough insulin at all. I mean, relatively there is an insulin deficiency, but there is still some amount of insulin which is produced. So you can see the empty jar over here. There is no insulin production in type 1, while in type 2 there is some amount of insulin production. But here the insulin resistance also plays a role. That is, as I told in the previous slide, there is something called as insulin resistance, where the insulin is quantity is there, but it's not able to act properly. And the next is something called as gestational diabetes, where the diabetes which occurs during pregnancy. So coming to the risk factors of diabetes, so a person who is having a family history of diabetes, who is overweight, there is lack of physical activity, unhealthy diet, and old age. So these are all the things which uh, lead to could lead to diabetes. So coming to the symptoms of diabetes, so we can expect excessive thirst, increased hunger, sudden weight loss, extreme tiredness, and frequent urination. Mind you, many a times the symptoms might be absent. So patients may not be having any of these symptoms, and it can be an incidental pickup itself. These findings are usually seen when the blood glucose are generally very high. So many a times, most of the patients are asymptomatic actually. And also, I have to tell that many of these patients are at increased risk of getting any infections. It could be a urinary tract infections, or it could be pneumonia or respiratory tract infections. So first we should know what is a normal blood glucose. So the normal blood glucose is a fasting, which is 70 to 100 milligram per DL, uh, and a 2 hour postprandial, that is 2 hour post meal, that is less than 140 milligram per DL. And diabetes is said to be there if the blood sugar fasting is more than 1 or equal to 126, and 2 hour postprandial is more than or equal to 200 milligram per DL. So this is there's something called as HbA1c, which is a 3 months average. So when do we say a person is normal? When do we say a person is pre-diabetic? And when do we say a person is diabetic? So as you can see, normal, that is in the green arrow. So below HbA1c below 5.7, below fasting blood glucose of below 99, and then glucose tolerance test or a 2 hour post-glucose load value of less than 140, this is a normal person. A pre-diabetic is one who has an A1C between 5.7 to 6.4 and fasting blood glucose of 100 to 125 and a 2-hour post-glucose load of 140 to 199. We call a person diabetic when his A1C, HbA1c is more than 6.5, more than or equal to 6.5. This HbA1c is nothing but it gives a 3 months average of the blood glucose. So an HbA1c of more than 6.5 or an fasting blood glucose of more than 126 or a glucose tolerance test 2-hour post value of more than 200. This qualifies as type 2 diabetes or diabetes for that. Now, there are certain complications of diabetes. This is the reason why we are so concerned about diabetes. Sometimes it's just not about the blood glucose numbers. We are more worried about the long-term complications of diabetes, which could include kidney failure, heart problems, eye problems, or even foot problems. So, as I told, there are multiple diabetic complications that can that occur in a diabetic patients. So, it could be a cardiovascular, that is a cardiac problem, or related to eyes, related to nerves, or foot, or related to the foot, or kidney care, or end of life care. So, coming to the management of diabetes, there are 4 aspects: lifestyle modification, diet, medication, and SMBG is self-monitoring of blood glucose. That is monitoring of the blood glucose at home. So, all these 4 things are very crucial. So, challenges for people with diabetes. So day to day and intraday changes in the glucose level pose challenges for people living with diabetes. So it's usually difficult to detect low and high blood glucose level, challenging to manage gestational diabetes, and tough to prevent complications. Now the glycemic goal for diabetes. So what is the recommended goals that patients should look at? So there are different guidelines. So what we generally follow is the ADA. So the ADA, American Diabetes Association, recommends an HbA1c of less than 7 and the glucose levels before a meal between 80 to 130 milligram per DL and glucose levels after a meal less than 180 milligram per DL. So coming to the importance of self-monitoring of blood glucose. So it is shown to be effective in blood glucose control for both type 1 and type 2 diabetic patients on insulin, and monitoring food and exercise, preventing high and low blood glucose episodes, and also it helps in adjusting the medications. And it's very important in achieving the glycemic goals. So the importance of self-monitoring of blood glucose is it will also tell you what to eat, which food is causing your blood sugars to go high. Since you're checking, you will come to know what is the food which is spiking your blood sugar, so you can make the necessary changes, and how much to exercise, preventing high and low blood glucose, and adjusting the medications. So, in comparison with the lab test, obviously within self-monitoring of blood glucose, it's a very instant report that you will get. Can be done at home. You don't need to go to the lab. Conveniently, you can do it anywhere. It's economical, and any time of the day it can be done. So definitely SMBG is a very important part in the self-monitoring of blood glucose is a very important part in diabetes care. How can we make use of SMBG? It helps in better understanding the disease, encourages to become involved in the diabetes management, and reduces anxiety about low blood glucose or hypoglycemia. So how doctors can make use of SMBG? It's also important for the doctors to know what are the daily trends or the normal trends of the patients. So it helps to plan meal and activities, alerts the risk of complications, informs the effectiveness of the therapy, helps in optimizing therapy, and provides information on dynamic blood glucose profile. So foundation of an healthy lifestyle includes good diet, exercise, and sleep, and also stress management. So these are the targets. So we would want a diabetic patient to have a fasting of 80 to 120 milligram per DL, 2 hour post breakfast, lunch or dinner between 120 to 160 milligram per DL, and people with DM with complications, we are slightly liberal. We want we would keep a fasting of 100 to 140, and post breakfast, lunch or dinner value between 140 to 200. So as I told, it's important to have a healthy meal plan, regular exercise, take your medicines as advised, and regular checkups. So in your diet, it is more about quality than quantity, and the most of the there's something called as a plate planner, where half of your plate should be with vegetables, and only 1/4 should be of the starch, and other 1/4 should be protein. So regular exercise is also a very important part in keeping your blood sugars under control, and you should be active for 30 to 60 minutes per day, and it is also okay to be active for at least 20 minutes at a time, 3 times a day. So regular medicines, your tablets and insulin, as per your doctor's prescription, if taken on time, will go a long way in keeping your blood glucose under control. So also it is very important to keep the three things which is very important is something called as ABC, that is HbA1c less than 7, blood pressure, that is BP less than 130/80, and cholesterol LDL less than 100 milligram per DL. So there are certain symptoms of low blood glucose and high blood sugars. I'll tell you mainly about low blood sugar. So generally they'll have sweating, trembling, dizziness, mood changes, hunger, headache, blurred vision, extreme tiredness. So this is very common when you delay your food, or when the insulin dose is on the higher side, and a patient don't take adequate food. That time the chances of hypoglycemia is high, and also when they delay their food or lunch, that time their chances of hypoglycemia is high. So also it is very important to take appropriate food care. So you should wash your feet every day with lukewarm water and soap, and dry your feet well, especially between the toes. Moisturize your feet. Also check your feet for blisters, cuts or sores. So as I told about physical activity, the recommendation is you should do at least 150 minutes of moderate to vigorous intensity aerobic physical activity per week in bouts of 10 minutes or more. And more the physical activity, it provides greater health benefits. So also adequate sleep duration is also very important. So somewhere around 7 to 9 hours is definitely required. Also stress management is very important. Meditation also will go a long way in reducing your stress. Regarding hormones and the changes which occur, just a few important slides I will go through. So there are a few things, changes which occur in the body. One is called the menopause, which most of us will be aware, which occurs in females, where there's abrupt loss of estrogen and progesterone production uh, following the cessation of ovarian function, and something called as andropause, a gradual decline in testosterone, which occurs in men, which begins at usually around 30 to 40 years, and which persists until death. And there is something called as andropause, adrenopause, which where there is a gradual reduction in something called as DHEA and DHEAS, which is secreted by the adrenal glands, and also something called as somatopause, where there is a reduction in growth hormone, comes from the pituitary gland, which occurs with age. So there is something called as the pituitary gland, which is the master gland, which controls all the hormones, most of the hormones in the body. So you can see this gland in the center, which is called as the pituitary gland. So you can see in the graph, this is the first graph shows the testosterone values, how it decreases with the age as the age advances. The second is something called as DHEAS, the hormone levels, how it goes down with age. Third is the IGF-1 or the growth hormone, how the growth hormone also reduces with age. So these are the changes which occur because of andropause, the somatopause, adrenopause. So as you can see, these are the things which predispose elderly patients to slightly increased risk of type 2 diabetes, increased blood pressure, decrease muscle mass, okay, and increase body fat mass, decrease bone density, and increase risk of obesity. So hormonal changes of aging is not only because of the aging process, but also because of inactivity which occurs with age. So the reduced growth hormone which occurs predisposes patients for increased risk of obesity, decreased lean body mass, and also decreases the bone density. So we are also aware about the menopause which occurs in females. So there can be certain factors which can lead to little earlier onset of menopause, which can include uh, certain genetic reasons, or it could be an autoimmune thing, or metabolic problems, or environmental problems. And the clinical aspects of ovarian aging is progressive decline in fertility, that is reduction in ovarian follicles, cessation of menstrual cycles. So as I told, there will be deterioration of the lipid profile with menopause. That is, the cholesterol levels can deteriorate. There can be cardiovascular risk, can be slightly more, and there can be changes in the adipose tissue distribution, that is the fat distribution, and also there can be something called as bone loss. That's what I've mentioned, like accelerated lumbar spine, BMD loss. BMD is bone mineral density loss, and also increased risk of type 2 diabetes and cardiovascular disease. There are many therapies which are available for menopause. One is the hormonal therapy. Other thing is non-hormonal drugs. And there are some behavioral therapies as well. And in case there are some troublesome genitourinary symptoms of menopause, in that case, we can give vaginal estrogen or moisturizers and lubricants. Coming next, which is a very important thing, is osteoporosis or weak bones. This is a very common thing which is seen more often in females. And so as you can see, the prevalence of weak bones or osteoporosis, what we say, in women aged 50 to 59 years, it's around 6.8%. And you can see the jump once they age between 70 to 79, it's 25.7%. And aged 80 years or older, it's 34.9%. Men are less prone for osteoporosis. So you can see that 70 to 79 years, they have 5% risk of osteoporosis. And women age 60 to 69 years, vertebral spine and hip fractures account for 24% of all fractures. And women aged 80 years and older, the risk increases to 67%. So there is something called as BMD testing, which we do via a scan called as a DEXA scan. So this DEXA scan is recommended for women, all women aged 65 years or men aged 70 years or older, to detect any evidence of osteoporosis. That is the weak bone, any evidence of weak bone is there or not. So how do we reduce the chances of fracture risk? Is make sure there is good nutrition, have adequate calcium intake in the diet, avoidance of smoking, regular physical activity, fall risk prevention, and exercise to promote strength and balance, and correcting the visual deficits, avoiding or minimizing medication such as thiazide diuretics, sedatives, and alpha blockers. Thank you.
Thank you very much, Dr. Shetty, Dr. Anirudh Shetty, for this very detailed presentation. As I mentioned, uh, Dr. Shetty's presentation and will be there on Seniors Today website on Monday evening, so you can refer to that. Um, Doctor, can you put off your screen share?
Yeah, yeah. 1 second, 1 second. Yes, I'll do that. Top share. Okay.
Yeah, great. Thank you.
Yes, thank you.
So, Doctor, quite a few questions have come to us via WhatsApp and via uh, chat. There's just a few questions on chat. One is, and you mentioned this, of course, but this is from Sharda Paravle. What are hormonal and metabolic changes of aging and the influence of lifestyle modification? So perhaps you already addressed the first thing, but what are the influences of lifestyle modifications that one can make for reducing the incidence of the negatives of hormonal and metabolic changes?
Yeah. So, see, there are certain things which, so age is a non-modifiable risk factor. You cannot modify the age. So there are certain things, changes which will naturally occur. But yes, we can do certain things which will definitely reduce the impact of these hormonal changes. So as I told in my presentation also that, say for example, your with respect to your osteoporosis or weak bones, just making sure that your calcium intake is adequate, making sure that your fall prevention, you prevent techniques for fall prevention, and correcting the visual deficit, which is many a times, simple, there can be simple astigmatism or refractive errors which are not corrected, and that can predispose to falls. And patient can develop, and once the senior citizens they develop fracture, it becomes very difficult after that, and many a times they can become bedridden as well. So these things make a big impact. And also making sure that you're physically active, in the sense you can do some resistance training also, to make sure that you prevent loss of muscles, that is called as sarcopenia actually. So loss of prevention of muscle via, you could use a low weight dumbbells, and just flexing the arms with the low weight dumbbells also will make sure that your muscles are preserved, because the sarcopenia will predispose also to development of something called as IGT, or impaired glucose tolerance, and that can also lead to diabetes. So preserving the muscle mass is also very important. And as I told, simple measures like fall prevention, adequate calcium intake, having make sure that you're having adequate amount of milk, curds, paneer, all these things are good sources of calcium, and these things will go a long way in preventing the metabolic changes.
Right. Uh, Doctor, this is an interesting and a tough question, tough situation that this person is in. Doctor, most uh, doctors, diabetes specialists, and general physicians advise a significant change of diet. But I live with my son and daughter-in-law, and going in for such a significant change in diet means putting them in trouble. Is it possible that I continue with the same food that they have, and is there something that I can do? Is having of fibers through things like isabgol a good way to take care of some of the unhealthy food that they have?
Yeah, that's a very good question, and it's a valid question also. Actually, that that is a problem which many people face actually. So and also it's very difficult to answer also, because you have, I mean, because they'll have to prepare in the house to separate, lunches for for the person who is diabetic, and for a person who is non-diabetic. So it becomes a problem. So that's a very valid question. It's very difficult to answer, but certain changes, like I would say, as you told, shifting to probably, so instead of white rice, if you could shift to something called as brown rice, that would be better, you know. So which even other people in the house can have. And also making, what do you say, uh, your fiber content having adequate fiber content. Uh, these things will help definitely. But sometimes it becomes difficult. Certain changes which both of the non-diabetic and diabetic people can follow, like as I told, switching to brown rice from white rice, which I think even the non-diabetic people can do. That will help certain extent.
Right. Thank you, Doctor. Doctor, there's another question which has come in. Is that my sugar levels have my sugar intake has totally gone down, but my fasting sugar continues to be at around 130, which, as your chart said, is above the danger level. And my HbA1c is also somewhere around 6.5 to 7. Sometimes it is 7. Sometimes it is 6.5. Sometimes it increases to 7. What should I do, doctor? Sorry, there's one more question that's coming from the same person. Is it that the medicines that I'm having are not having an impact on me?
Okay, so so I assume she's already on, as you told, she's already on medications, isn't it?
Right.
So she hasn't. So the value what I showed the in the slides are for diagnosis of diabetes, and yeah, so any HbA1c value less than 7 is definitely, as I told, in the according to the ADA guidelines, any HbA1c value less than 7 is definitely acceptable. So anywhere between 6.5 to 7 is acceptable, and a fasting value of less than 130 is also acceptable. So most of the values what you're telling seems to be okay. There is nothing to worry. I think the medicines are working well, provided your fasting is less than 130 and the HbA1c is less than 7. I think it is fine. It's not an issue at all.
Right. Thank you. Doctor, there's another question that has come in, which is a little tricky. Says, while I have a regular physician whom I go to, who's also a specialist like yourself in diabetes management, but it's impossible to get appointments with them regularly. My question is very simple. The medicines that the doctor has advised me are very expensive. While I've been having them for a year, the medicine, and I know that you have, Mr. Maheshwari has said, no specific medical questions have to be asked, but the medicines that are advised to me are over 300 rupees for a strip of 10. Is it okay for me to go in for a generic medicine?
Yeah, see, I have, definitely you can try generic medicines, provided, see, you can monitor your blood sugars. You can always do that. It's not a problem. So you can buy generics and see whether it has the same impact or not. So there is no, I don't think there is any harm in buying the generic medicines. See, but we must also remember that many a times they don't undergo the there is something called as pharmacokinetic and pharmacodynamic profiles, and many studies which other the molecules which you are telling, the innovator molecule they undergo. So these things, these PKPD profiles and all, the other molecule, what the generic molecules don't undergo this test. So we don't know, how effective it is, but definitely you can give it a try. Check the blood glucose on a regular basis and see what is happening, whether it is similar to what it was when you were on the costly medicines or not. It is somewhere close by, then why not? You can get with the generic medicines also. So that should be also okay. It's not a
So
problem.
sorry, if I can, just rephrase what you said. So what basically you're saying is that generic medicines can be tried out, but if you're trying it out, then you should also take your blood sugar tests regularly, so that you know if they are impacting you positively in the way the regular medicines were doing, right? I think we've lost. Sorry, doctor, can you hear us?
Yeah, exactly.
Yeah. Okay. Gosh, we have lost Dr. Shetty, but he'll join back. He's on the road in Bangalore, and it's a 1.5 hour drive for him. And Shetty.
Am I
Yes.
audible?
Yes, you are audible.
Yes, yes, yes.
Yeah.
You're absolutely right. What you've told, bang on. It's what you told is absolutely right. I mean, keep your physician also in the loop. So even he should be aware of it. Uh, that you're changing. You'd like to change to a generic and then recheck and then decide. And you can just tell him that it's little expensive. You will definitely change it and give a generic molecule. It should not be an issue.
Right. This person has sent another question. Says, are these and diabetes medicines lifelong?
Yeah. So see, most of the cases, yes, most of the cases, most of the patients, they do require diabetes for a long duration of time. Most of the times it is lifelong. In some cases, say there, we can, diabetes can go into remission, what we say as people call it as reversibility. So, but most of the cases, especially when the duration of diabetes is long standing, generally they require medicines for a long time. So, most of the cases, yes, the answer would be yes.
Thank you, Doctor, for all your time today. But I'm going to ask you one question, Doctor. And most of our attendees here today are senior citizens, and they have their children, grandchildren of people of your age.
My
And
age.
how do you take, you have a busy schedule. You are spending an hour and a half one way. So I'm sure you're spending 3 hours
Yeah.
a day on the road. How does Dr. Anirudh Shetty take care of himself? And what can our senior attendees here advise their children, grandchildren, nephews, nieces, whatever, to take care of themselves? How do you take care of yourself?
Yeah. So, I would advise them to advise their make to tell their grandchildren not to stay in Bangalore. Otherwise, you're traveling like me for 1.5 hours one way. So better to uh, stay in a 2 tier or 3 tier city. But jokes apart, yes. So I would say because now, see, everyone's lifestyle has changed. It's not how it was 20, 30 years back, where our physical activity, I mean, even though we used to be more active 20 years back. So most of us didn't have our, say, four-wheelers. We didn't have the cars and two-wheelers. Very few of them had. So there was more physical activity 20 years back. Now the lifestyle has changed. So all these are lifestyle disorders only. So more, I would say recommend them to be active physically. Make sure that they do 10,000 steps per day, which is the recommendation. So at least 5 days a week, if they do 10,000 steps per day, I think that will go a long way in taking care of their health. And also get your blood checks done at least yearly once. Get your blood checks done, so we can pick up if there is something it could be picked up at an earlier time than later on. So that would definitely help them.
Thank you very much, Dr. Anirudh Shetty, for joining us. Have a good, safe drive. I know we could see the potholes on the Bengaluru
Yeah.
roads well, because as your car was shaking. But thank you very much, and thank you to the team at Narayana Health for facilitating this. As always, Doctor, we have our health webinar sessions. We've been doing it for the last 4 years plus. We've had around 250 sessions with top doctors from across the country, and we have it at 5 p.m. sharp every Saturday. So we will be back once again next Saturday at 5 p.m. This is the Independence Day week that's coming up, and the next issue of Seniors Today is also going to be up on August 15th, and it's free of cost. So you should check the Seniors Today website. We've had over 1,000 people who were watching you on YouTube, Dr. Shetty, plus around 100 plus at the peak on Zoom. So there are a host of people who have taken advantage of this session. But those of you who have not been able to do it, or if you would like your near and dear to also watch it, the recording of the health webinar will be up on the Seniors Today website, that is seniorstoday.in, on Monday evening, and you can watch it. And we have a medical practitioner who works with the Indian Army, who's going to be writing the transcript of writing the takeaways, not the transcript of this session. As you are aware, we now have Seniors Today has the Evergreen Club as part of our family, so you can download the app on Android or iPhones and watch and take part of the various sessions that we've had. We've had the 100th episode of the yoga session that we had yesterday, and there are a host of sessions which happen morning, afternoon, evening. So please take care of that. Please take advantage of this, and it's all free of cost and no conditions applied and no strings attached. Thank you very much, Dr. Shetty, for this session.